All right, welcome. This is our fourth week together, and I am coming to you from different surroundings once again. I'm traveling again, just like I was when I did the week 3 videos. This time I'm in Latvia in northeastern Europe. I'm teaching for a week. One of my colleagues from Azusa Pacific is here teaching with me. We're teaching some undergraduate age students. It's not necessarily a traditional undergraduate program like you would see in the States, but we're here teaching some students, 15, 16 of them, and the focus of that instruction has to do with some ministry discernment, the process that they're in. So they're devoting a year of their lives to kind of figure out what they should be doing with their lives. So I'm taking a little break from that to come to you from Latvia, Northern Europe, and I've got the room set up, I think, like I like it, and hopefully the video is coming across well, and you will be, we'll learn something along the way together. So this week, I'm going to try to combine a couple of things from the Fowler text from Provisions 3 and 4. In fact, next week I may come at it from a different angle altogether and come back to 3 and 4 some. So Provision 3, the nurse promotes, advocates for and protects the rights, health, and safety of the patient. Provision 4, the nurse has the authority, accountability, and responsibility for nursing practice, makes decision, and takes action consistent with the obligation to promote health and to provide optimal care. So, as you know, I am not an RN. I don't claim to be, but I do work in the theology area. So I want to kind of help process this consistent with what APU processes and regards as important, and part of that, of course, is the Christian scripture. And we are focusing most of our attention on the books of Luke and Acts, but and I'm trying to take some time out to deal specifically with the Fowler text and just tell you how I help process some of the things that I believe I'm picking up in the text. So I want to start with a story about my good friend Tom Sabak. Tom was the dean at Franklin Pierce University in New Hampshire. I worked with Tom while I was there for a couple of years, and Tom had this habit of saying when it came to any kind of crucial decision, he said, "John, we just have to do the right thing. We have to do the right thing." And Tom was an advocate for doing the right thing. Absolutely, that was important. Still helps form me in my decision making. It wasn't that it was something I didn't know already, but it was something that I guess I needed in some way to have that reiterated for me. We've got to do the right thing. Here's my problem, especially when you get into areas where we have an ethical dilemma, right? It's not that we always have clear-cut choices between what's right and what's wrong. Very often what we have are two rights, or we may have two things that are wrong, and we have to figure out which one is the less wrong. And that's where ethical decision-making is, really, really difficult. And then we have these competing loyalties. So there may be a situation where you feel a certain loyalty to the patient, but you feel a loyalty to the hospital or to the healthcare agency as well. There may be in our families, right? There may be loyalties that we feel to one member of the family, but that may compromise our loyalty and our obligations to other members of the family. So these things are difficult, to be sure. One of the things that I appreciate about the Fowler text, in fact, I want to draw your attention to page 47. The last paragraph begins, "Who ought to receive the benefits of research and bear its burdens? This is a question of justice," she says. Well, that really resonates with me. Most of my academic study of the Bible, as you know, has been focused on the Hebrew Bible, or the Old Testament, sometimes called the First Testament. And when I read the Hebrew Bible, there's quite a lot in there about justice. Now, some people think about that justice as retribution, how God is going to come back at somebody and judge them. That is Certainly there's judgment. There are judgment texts in the Old Testament. That's very true. But the question is, upon what basis is that judgment there? The God of the Hebrew Bible, the God of the Hebrew people, is one that, let's assume for the moment, okay, and this is an assumption that you may not be comfortable with, or let me put it this way, this is a conclusion that you may not be comfortable with, and I understand that. But let us assume for the moment that the Hebrew prophets, the writers of the Hebrew Bible, are indeed hearing from God. Let's just assume that for the moment. And one of the things that they are hearing, or that they believe that they need to communicate from God, is this issue of justice. So if there is this judgment to come, it's because of something. It's because of some violation. It's because some kind of commandment has been broken, or it's because some kind of precept has been compromised. There's something that spurs God on to action. And part of that action is the announcement of judgment. In fact, here teaching in Latvia, we're looking at the book of Obadiah, one of the Old Testament prophets. 21 verses. It's the whole book. It's very short. Fits on 2 pages if you're interested in reading it. And one of the things that I'm doing is using Obadiah as a test case for how to interpret the Bible. And so some of the things that you and I talk about, I'm talking about with these students as well. And we're asking those questions about interpretation, repeated words, repeated phrases, and what are the theological and or ethical implications of the text. And one of the things that we see over and over again in the Hebrew prophets is an emphasis on justice. Now that starts, I would contend that it's all through the Hebrew Bible, but one of the texts that I like to point to is in the 5th book, the book of Deuteronomy, in chapter 16, verse 20. And in that verse, in English Bibles, it's commonly translated something like justice, only justice. Now, the word only doesn't appear in the original text, but this is the way we translate it. Because in the original text, it's just justice, justice. Or another way to translate the word is righteousness, righteousness. And this word in the Hebrew Bible tends to be one that focuses on interpersonal relationships. I think, though it's not always the case, but I think that most of our ethical dilemmas are personal dilemmas. I don't mean that they're necessarily personal dilemmas within us, and that's true, but they're dilemmas that involve people. That's not just a dilemma that involves financial structures or something. Those always involve people. People are always in the mix somehow. So when the writer says, I want justice, only justice, or righteousness, only righteousness, he's saying, or she is saying, we need to get at what is good for people. And that is something that I think comes out really clearly in the Fowler text. As you are tasked with, and patients are committed to you for their care, you're going to face ethical dilemmas. You're going to face those questions of how do I put the patient first, whether it's patient safety, patient confidentiality, patient privacy. How do I do that in the best way possible and yet deliver optimum care? So I want to maybe try to help process that through the mind of a theologian who gives attention to these biblical texts, and maybe that will inform your process a little bit. Okay, so we'll come back in just a little bit and unpack this justice issue a little bit more. Stay with me.